listening to the Agent Survival Guide podcast, and we are back with another super focused Friday 5 episode. On November 26th, CMS released their 2026 Medicare Advantage and Medicare Part D proposed rule. If it seems a little early to be talking about coverage year 2026, the release was actually later this year than it was last year. But as usual, we like to read through what CMS has to say and bring that insight back to you as far as what will impact you and your clients. So today we are focusing in on this proposed legislation with 5 things from CMS's 2026 MA and Part D proposed rule. Some things to keep in mind. We normally count down to our title topic, but we are not doing that this time around. Our 5 mentions are in no particular order. CMS had 17 provisions in the proposed rule, but we are just touching on 5 today, and we did not match our numbers to their numbers. However, we are using the CMS provision titles in our mentions, mainly so it's easier to reference in your own review of the proposed legislation. With that being said, we'll start out with number 1, Part D coverage of anti-obesity medications and application to the Medicaid program. For the most part, weight loss drugs have not been covered by Medicare Part D, even if they are used for treatment of those medically diagnosed with obesity. But because of the growing prevalence of obesity in the American population, CMS is beginning to rethink how Part D handles anti-obesity medications, or AOMs. Right now, AOMs can be covered in Part D when the drug is used to treat a different condition with a, quote, medically accepted indication other than weight loss or weight management, end quote. The example most of us probably are familiar with, GLP-1 drugs used to treat diabetes. Because diabetes is a medically accepted indication, or MAI, a GLP-1 has a better chance of being covered by Part D. Coverage is not guaranteed. Every formulary is different depending on the carrier or plan, but it illustrates the point. Now, despite the fact that GLP-1s can and are currently prescribed as a treatment to manage weight, because weight loss and weight management aren't considered to be MAIs, when used in that fashion, the drug would not be eligible to be covered by Medicare Part D. CMS is proposing a change in their interpretation of obesity, recognizing it as a chronic disease. With that reclassification, obesity would join other diseases with specific treatments. CMS proposes to permit coverage of AOMs to treat obesity when those drugs are used to, quote, reduce excess body weight and maintain weight reduction long-term for individuals with obesity, end quote. Also, important to note that the interpretation does not extend to those who are overweight. The individual must be diagnosed with obesity. Being overweight is not classified by CMS as a disease. The classification would not only apply to Medicare Part D, it would also apply to Medicaid for those states who haven't already passed similar legislation. Number 2, ensuring equitable access to Medicare Advantage services, guardrails for artificial intelligence. In late 2023, President Biden announced his executive order on artificial intelligence, the first set of government guardrails on the responsible use of AI. That original order was comprehensive, to say the least. From our November 3rd Friday 5 episode in 2023, we mentioned that it outlined standards for safety, security, privacy, equity rights, and civic rights. There's a section dedicated to supporting workers, promoting innovation and competition, advancing American leadership abroad, and, of course, making sure that the government uses AI responsibly and effectively. In the years since that initial order, we have a better understanding of AI use cases, particularly in the health industry, and CMS is focusing on making sure that access to care remains equitable and fair. CMS proposes a clarification that would hold AI-powered automated services to the same standards as human-powered care services. Every beneficiary must receive care that complies with all benefit and beneficiary protections outlined by Social Security in Section 1852B. They must be given equal access to services, and they can't be discriminated against based on their health status. And again, a lot of these rules are in place for how a beneficiary receives care from a plan. This is applying that same set of rules to AI-powered patient interactions and services. Number 3, promoting informed choice. There were a couple of provisions under this heading. We will start out with the proposal to format provider directories for Medicare Plan Finder. Looking through provider directory data isn't always the easiest experience. A lot of the data is the same, but the way it is presented, how we search for it, a lot of that varies from carrier to carrier. Currently, carrier provider directories live on the carrier site. CMS is proposing that carriers submit that data to CMS, and they will put all of that data into one large directory where consumers can easily search through the directory to find a provider. Semantically, it's going to need some coordinating to make sure that the directory is as updated as it possibly can be, and that CMS is getting those updates into their directory as quickly as carriers are able to update the info on their own sites. According to the proposal, when a provider makes a change to their information, the plan will have a 30-day window to notify CMS of the change in order to update the Medicare Plan Finder, or MPF. According to CMS, other details will be forthcoming in future guidance. Number 4, another entry under promoting informed choice, enhancing review of marketing and communications. CMS proposed a few updates to their definition of marketing in response to complaints about those TV ads for Medicare Advantage plans. Definitely unfortunate that a few bad actors are creating so much disturbance in our industry. It is certainly a tricky thing to get right. When CMS clarified that the difference between communication and marketing materials had to do with content and intent, they did not anticipate the events of the past few years, and they mentioned that in the full proposal. Moving forward, they plan to, quote, eliminate the content standard of the marketing definition so that all communications materials and activities that meet the existing intent standard are considered marketing for purposes of CMS's MA and Part D marketing and communications regulations, end quote. In addition to removing the content standard of the marketing definition, CMS also plans to edit the definition of an advertisement. According to the proposal, quote, considering the nature of advertisements pertaining to MA and Part D, CMS believes that most, if not all, advertisements pertaining to MA and Part D created or administered by an MA organization or Part D sponsor or any downstream entity operating on their behalf will fall under the proposed updated marketing definition, end quote. And if you're wondering about a potential influx of materials to review, CMS addresses that concern, saying, quote, the overall burden will be tempered by the fact that we anticipate the majority of them will be accepted as file and use, end quote. That is the system, quote, where plans may distribute or make available certain types of marketing materials designated by CMS based on the material's content, audience, and intended use as they apply to potential risk to the beneficiary 5 days following submission, end quote. CMS is also planning to do away with what they call extraneous numbering, which won't be needed once all marketing materials are submitted through the new system. And the last thing I'll mention under this provision today, CMS addressed how they plan to decide the intent of marketing materials they receive for review. They mention stated intent, which is when it's easy for a beneficiary to understand what the intent of a material is. But what about when that intent is more implied rather than stated? Their examples included influencing the decision-making process when a beneficiary is selecting a plan, influencing a beneficiary to stay enrolled in a plan, so retention marketing, and drawing a beneficiary's attention to a plan or set of plans. According to CMS, there are times when, quote, the activities or materials of an MA organization or Part D sponsor may meet the regulatory definition of marketing, even if it is not immediately apparent to the recipient of such materials or activities, end quote. CMS does mention they are looking for comments on the proposal, as well as the financial implications through the regular comment process. Moving on to the last provision I will mention today, also falling under the more broad promoting informed choice category, expanding agent and broker requirements regarding Medicare savings programs, extra help, and Medigap at number 5. This one is pretty straightforward. Last year, CMS outlined a sales appointment checklist for agents selling Medicare plans to follow when meeting with their clients. For coverage year 2026, CMS is adding a few new steps to the checklist while also revamping the format, quote, to put the newly proposed and existing requirements into a more organized and reader-friendly format, end quote. The new steps in the process involve the Low-Income Subsidy Program, the Medicare Savings Programs, and Medicare Supplement Guaranteed Issue Rights. One of the proposed requirements you might already be doing during your sales appointments, and that is explaining and checking beneficiary eligibility in the Low-Income Subsidy or Extra Help program prior to enrollment. Agents would also be required to explain and check eligibility for other Medicare savings programs. Another requirement, should the proposal go through, explaining future Medicare supplement eligibility to individuals enrolling in Medicare Advantage either for the first time or switching to it from traditional Medicare. And then the last potential new requirement, pausing for beneficiary questions. This is a simple step that can alleviate a lot of problems in any kind of sit-down conversation. A very open-ended, do you have any questions? And you want it open-ended because it will make them take pause and think about potential questions. Take it from someone who knows how to interview. And while CMS might have it on their revamped list once, I would actually recommend asking that question several times as you're covering the information on that checklist. That is a lot of content to go through, and I wholeheartedly believe in giving people a chance to ask questions multiple times. Now, as I said, the provisions mentioned here today, they are just 5 of the 17 outlined in the CMS 2026 MA and Part D proposed rule. We will be linking to the full 713-page document in our episode notes, as well as the press release from CMS. I enjoy highlighting my takeaways from pending legislation like this, but we definitely recommend that agents read through all of the changes as well. My takeaways will be different than yours because we are focused on slightly different things. As our compliance team digs into the proposed rule a little bit more, we will be bringing you more information. But in the meantime, if you have questions that you'd like us to answer from what we mentioned here today, or maybe one of the provisions we did not mention, please let us know. You can email us at asgpodcast@ritterim.com. That's asgpodcast, no spaces, @ritterim.com. Thanks so much for listening today. I hope you have a great weekend. Stay healthy and stay safe out there, and we will see you next week. The Agent Survival Guide podcast is a production of Ritter Insurance Marketing, an integrity company. This episode was written and produced by me, Sarah Ruppel, script editing and fact check by Tina Lamoureux, podcast design by Urban Rivera, artwork by Vivian Zhao. Follow along with us wherever you like to listen.